Now, Representative Diane Black has an idea to try to keep healthcare costs down. Let's just turn away poor people from the emergency room. Now, this came up during a conversation with Chuck Todd on Friday, and well, let me show you the context of that conversation, and we'll break it down.
I guess, I mean, not to get into a philosophical discussion, but when you have every doctor saying that if anybody that comes to an emergency room, they're going to treat them, you're not. It's not a market. Right, that sort of messes that you're being forced into figuring out how to subsidize that free health care that nobody pays for in the emergency room.
So let me tell you, Chuck, I'm an emergency room nurse. There are people that came into my emergency room that I, the nurse, was the first one to see them.
Right.
That I could have sent them to a walk-in clinic or their doctor the next day, but because of a law that Congress put into place to say no, I have to treat everybody that walks in that emergency room. You took away our ability to be able to say no, an emergency room is not the proper place. And then you put a burden on top of that to say you must do that.
So you would get rid of the law that mandates emergency rooms to see every patient that shows up?
I would get rid of a law that says that you are not allowed as a healthcare professional to make that decision about whether someone can be appropriately treated the next day or at a walk-in clinic or at their doctor. But we must treat everybody that walks in, whether you've had a sore throat for a week. We must see them. And that crowds the emergency room. It drives the cost of emergencies up. And so, yeah, if someone comes in from an auto accident, I don't want to ask whether they have insurance or not. I'm going to take care of them. But what it did is crowd my emergency room where I worked and disallowed me from using my good judgment skills, of which I was trained to do, and doctors are as well. And it's the federal government said, you must, and you can't make those decisions. And I think that was a poor thing for us to do. It's driven the cost of health care up, and especially in the emergency rooms.
Okay. Now look, without context, that actually sounds fairly reasonable, especially if you don't know the history, right? Oh yeah, of course. You should allow the nurses on the ground to make the decision on who to treat. If somebody's obviously not, super ill or in an emergency situation, then yes, you should direct them to urgent care or their doctor or whatever. Now, again, that sounds reasonable until you understand what actually happens in practice when you take away this protection, because this protection didn't always exist. Now, this was a problem back in the 1980s. Now, Congress had noticed during that time period that people would often fall victim to a practice known as patient dumping. Now, what is that? Now, that is basically a practice where hospitals would deny treatment to patients or send them elsewhere, usually because the person was either homeless or didn't have insurance. Now, many of these patients also happen to be unemployed and people of color. So, they take poor people come in, they can't get health care anywhere else, they go into the emergency room, and the hospital's like, yeah, no, we're not going to treat you, you're poor, you're black, and you have no insurance, bye. But wait, I actually have an emergency, there's something wrong with me. No, we don't care, you can't pay, bye. That's what would happen. Now, in response to these stories that were coming out during the 80s, the uber-liberal president, Ronald Reagan, in 1986, signed into law the Emergency Medical Treatment in Active Labor Act. Now, that act made it so that emergency rooms were required to treat anyone who came in, regardless of whether or not you had the ability to pay. Nobody can be denied medical care at the ER. That's Ronald Reagan. Okay. Now, what happened beforehand, right? Well, again, patients were dumped. And one of the reasons that they put this law into place is because it was shown that individuals who were dumped elsewhere by hospitals were more likely to die. Or the delayed care often jeopardized the patient's health, making whatever condition that they had before even worse. Now, the law put a particular focus on pregnant women, hence the active labor in the law's name, to ensure that they would be able to deliver their babies and receive full care, whether or not they were poor, minority, or had insurance. Now, that part, surprisingly, was because of the pro-life movement, who in this case was actually pro-life. Now, they said, now, wait a minute here. You just can't dump pregnant women off. What about the fetus? What about the fetus? We got to make sure the fetus is born. You can't just dump them off somewhere else. Hey, look, surprising that they cared that much about the pregnant woman. But hey, I'll take it, right? Now, obviously, what happens if you change that law is that these hospitals would revert back to patient dumping of people who are poor and largely minority. I mean, look, it still actually kind of happens today, although in different forms. You guys remember I had Amy Vallely on the show. She's running for a district in Nevada as a progressive. She's actually one of the Justice Democrats now. Now, I had her on the show for an interview, and she actually told me a story about what happened with her daughter and why she came over to single payer. Now, what happened to her daughter, Shaylin, is that she was denied care at the emergency room. Now, when she arrived there, and it's a long story, you can go and check out the video. She'll explain it in detail. But very, very simply, she went to the ER because she noticed that there was a problem. She was told when she got there that she had to go to urgent care or to her doctor. Now, she didn't think that she had insurance at the time. And she's like, I don't know. I don't think I have insurance. I'm in between jobs. I'm also moving. But this is a big problem. I have had this problem for a long time. It really, really hurts. Just please check me out. Now, what were her symptoms? Her symptoms were that of deep vein thrombosis. A cursory examination would have easily caught the symptoms of deep vein thrombosis. However, she was not treated. She was urged to go somewhere else. And they believe it's because she was half African American and urged to also poor. Now, what she experienced was known as a wallet biopsy, right? Now, that's actually slightly different than patient dumping. Now, with dumping, they would literally take the patient and drop them off at another hospital or sometimes into the street. And people had no recourse. Now, with the wallet biopsy, there actually is a recourse, and that hospital is being sued. But again, if we go back to the rules before, then patients don't have a recourse. And that's what this is about. Now, what's funny is that there is actually a way to get around this law. Now, if a hospital really is having problems with people coming into the ER that actually don't need to go there and they're clogging up the ER, like Ms. Black says, well, okay, how do you stop that? Well, you just, and be able to legally turn away patients. Don't accept Medicare funds. That's it. So stop taking that sweet, sweet Medicare money, and you can do whatever you want if you're a private hospital. Now, it turns out that treating all patients is a requirement for hospitals to get Medicare funds. So, in a way, you can already turn people away, as long as you're not getting government money. But see, she wants to do that and still have her hospital get paid by Medicare. And that, unfortunately, is not going to happen for her. Now, there's one more thing in this law. It's not perfect, obviously. And look, you could add things, more patient protections into it. But I believe that the best way to end the practice of both wallet biopsies and patient dumping, which still does happen, by the way, is to go to Medicare for all. Now, I mean, here's the the benefits of Medicare for all. Hospitals, for example, won't ever have to worry about not getting paid for their services. Why? Because everyone is covered. Everyone's covered by Medicare. Not only that, but look, she says she's worried about overcrowding, right? Which is a real problem. Yes, emergency rooms do get crowded. Now, you might think that, well, but if we give everybody insurance, then they're all going to go to the emergency room. No, that's actually not how it works. When everybody has health care, not access to health care, but when everybody actually has health care, they can go and do more preventative medicine. Now, preventative medicine actually cuts down on the need for emergency services because people can get things checked out. Now, sometimes large problems grow from small problems that can't get checked out, and then that's when you need emergency services. if you actually do something about it beforehand, then you don't need those emergency services, okay? Not only that, but you wouldn't have uninsured people having to rely on emergency services for their health care. Now, the ACA made some headway on that issue by reducing the numbers of people who are uninsured, but at the same time, it's not enough. It's not enough. That's one of the reasons that we need to move towards a single-payer system, Medicare for all. This is why we need to move forward, instead of what Ms. Black says and what she advocates, which would be going backwards. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.